Okay, hey guys, welcome to another video on microbiology. A chapter which we will be dealing today is on infection, primarily on hospital infection. So, the topics that are given for hospital infection in your first year BSc AHS is causative agents of the hospital infection, mode of transmission of it, and the prophylaxis of it. So, the main topics that will be dealt today is on a hospital infection, the causative agents, mode of transmission, and prophylaxis. So, this is the first year portion. In second year BSc ATOT also, they have mentioned about hospital acquired infections. We'll see what are the topics under hospital acquired infections in the second year ATOT. So here we have applied microbiology for the second year. Healthcare associated infection is one of the topic under the subject, and you have antimicrobial resistance, which will be dealt in another video. So firstly, for a healthcare associated infection, there are topics which include infection that patients acquire during the course of receiving treatment for other conditions within a healthcare setting, like methicillin resistant staphylococcus aureus infection, infections caused by clostridium difficile, vancomycin resistant enterococci, etc. uh, Under healthcare associated infection, we have catheter related bloodstream infection, ventilator associated pneumonia, and catheter related urinary tract infection. So the surveillance of emerging resistance and changing flora seen is also a topic. Then we have the impact and the cost attributed to the hospital associated infection. So these are the different topics that are included in your second year BSc AT and OT applied microbiology subject. So the textbook which I will be referring in this video is on from CP Baveja, the textbook of microbiology. Here I'm using 5th edition. You can use the new edition textbook also. So the book is from CP Baveja. Without further delay, we'll see what the chapter consists of in this textbook. Okay, it's chapter 75 in this textbook, health associated infection. So the main topics that will be dealt in this chapter are the definition of healthcare associated infection, sources of infection, modes of transmission, diagnosis and control of the infection, infection control policy, factors influencing an infection, then microorganisms that cause infection, common health associated infections, and prevention of it. So these are the different topics that will be dealt in health associated infection. Going firstly to the definition of health associated infection, the term health associated infection, health care infection, hospital acquired infection, hospital associated infection, hospital infection, or nosocomial infection are one and the same. So here nosocomial is hospital. So these are the different terms that is used for the same health associated infection. So this health associated infection is defined as infection developed in the patient after admission to the hospital, which was neither present, it wasn't present before getting admitted, nor was it in the intubation period at the time of hospitalization. Such infections may become evident during their stay in the hospital or sometimes after they discharge. So these health associated infections are acquired during the stay in hospital, or they are the time of the discharge. After they are discharged from the hospitals, they might acquire these type of infection. So this infection is not observed in patient when he is in the hospital, or when he is in the incubation period. Incubation in the sense, he is being admitted in the hospital. So these infections are not observed at this time, but they are observed when during the stay in the hospital or at the time of discharge. So that is the definition of health associated infection. Moving to the factors influencing infection, the health associated infection is probably a great problem today, despite advances in hygiene and treatment of infecting organism. Several factors contributing to the occurrence and severity of this infections include. So the factors that influence infection or the cause of the infection could be: firstly, susceptible patients. They are suppressive patients or diabetic patients are usually uh, having very impaired defense mechanism. They have a very impaired defense mechanism, that is their body immune system is not strong enough to act against the infections that is being acquired during the stay in hospital. So in these patients such as diabetics, immunosuppression, and patients with prosthetic implants, they have very low immune defense system. So these diseases like diabetes or immunosuppression is in the sense the immune system is being suppressed or stopped, not completely, but is not working at the moment. And the patients with prosthetic implants, prosthetic is the bone implants that are being put, or the external implants or metal rods that are being placed in the human body, that is called as prosthetic implants. So in these type of patient, the cause of infection is more high. Moving to the hospital environment, the second factor of infection. So the environment is heavily laden with wide variety of pathogens. So there is a wide variety of pathogens which are present in air, dust, water, food, or antiseptic lotions also. So the equipments that are placed in a hospital can also be contaminated by certain pathogens which are present on bedding, linen, utensils, may act as fomites. So fomites are the pathogens which are present on bed or the linen, that is the cloth material, or on the utensils, the things that the patient is using. So these might contain pathogens on them. So these are called as fomites. The patient shed the organism from their bodies, while hospital personnel spread these organisms through their hands and clothes. So it is always uh, from the patient to the healthcare personnel to the next patient. So this could be transmitted from the hands or the clothes. So every time you see a patient, you have to use a sanitizer or a glove that keeps the patient infection being transmitted to the other patients who is being admitted in the hospital. So that is how we could avoid the hospital acquired infection. Moving to the diagnostic or therapeutic procedure. During diagnostic or therapeutic procedures, such as insertion of urethral or intravenous catheters, the slightest lapse in sepsis may lead to infection. So whenever the IV cannulas are given or the catheters are inserted to the urethra, the sterility should be maintained to the highest level. Otherwise, there might lead to asepsis. Asepsis, in the sense, sepsis in the sense the bacterial attack or the pathogen attack on the patient's human body. So that is how we have to avoid the sepsis of the urethral part or the intravenous part. Then the drug resistance. Hospital infections are generally refractory to treatment as the infecting agents are usually multi-drug resistance. Few organisms could be drug resistant. Whenever you administer a drug to the patient, it is of no use and it doesn't show any outcome. So that is considered to be multi-drug resistance or a drug resistance by the pathogen to the drug that is being given. Transfusion. blood products, intravenous fluids used for transfusion, if not properly screened, it can transmit many infections. So these blood related and blood product or intravenous fluids that are transfused to the patient should be kept very sterile and should be monitored and screened properly. If it isn't done properly, there are chances of getting infection from the blood transfusion also, like the one which we commonly know about HIV, HCV. These are the blood products and intravenous fluids that can cause infection to the other person or the non HIV people. So that could also be a factor of infection. Moving to the advances in medical progress, advance in treatment of cancer, organ transplant, implanted prosthesis, and other sophisticated technology can enhance the risk of infection. So, treatment of cancer, organ transplantation, and implanted prosthesis are the different advances that has been taking place in the present times. So, these could also these sophisticated technologies can also cause the risk of infection to be high. So that is advances in medical progress. So that completes the six different factors that are causing infections in the people who are staying in the hospital or are at the time of the discharge from the hospital. So the sources of infection could be of two types, which is exogenous and endogenous. So under exogenous, the hospital infection is mostly exogenous from another patient or member of the staff or from the environment in the hospital. Patients and hospital personnel suffering from infection or asymptomatic carriers are the most important source. Environmental sources include inanimate objects, air, water, and food in the hospital. Inanimate objects in the hospital are medical equipments like endoscopes, cystoscopes, catheters, etc. Bedpans, surface contaminated by patients, secretions, excretions, blood, and body fluids. So, exogenous is in the sense that from one patient or the member of the staff, the infection might be transmitted. So, that is hospital infection that is being acquired from the other patient, not from the same one, but from another patient. It is being transmitted from someone else to the patient, or from the staff who is being working without unhygiene practices might transmit another patient's infection to the patient. So these exogenous infection could be from the sources of inanimate objects or air or the contaminated water or food in the hospital that is being consumed by the patient. So these inanimate objects include the medical equipments like endoscopes. Endoscopes are used to see the stomach or the from the esophagus. It is being inserted and observed inside the stomach. So when these endoscopes are not cleaned properly, the infection might go into your stomach. So that is called one of the medical equipment. Cystoscopes are being used to observe inside the urethra or the genital areas wherein the formation of any tumors could be observed, or the leak or the any infection that is being happening in cystoscope can be observed over there. So that infection of a cystoscopes could be high if it isn't sterilized properly, and catheters also. So bedpans could also be one of the type of hospital infection that can be acquired. Then the surface contaminated by the patient either by secretions, excretions, blood or body fluids. These could also be a exogenous infection, source of infection. Endogenous is the patient's own flora may invade the patient's tissues during some surgical operation or instrumental manipulations. Patient's own flora may invade within the patient's tissue. Whenever the surgical operation is over, the dressing should be properly maintained. Otherwise, the patient's own bacterial flora or any other pathogens that is being present on the skin of the patient might go penetrate into the surgical area and cause infection or the sepsis over there. Thereby, like wound healing cannot be faster. So that is how the endogenous infection might occur. Then there are different types of microorganisms that could be acquired in the hospital stay. One such is Staphylococcus aureus strains, which is resistant to multiple antibiotics and is spread globally in 1950s to 1960s. It has been colonizing in hospitals and continues to be a very common agent in nosocomial infection. And there is another microorganism which is Staphylococcus epidermidis and group D streptococcus. So these are the different organisms that are being associated with the health infections. In recent decades, you can find that Escherichia coli, Klebsiella, Enterobacter, Proteus, Serratia are the different microorganisms that have been causing the hospital acquired infections. These are particularly because of dissemination among them of R factor conferring multi drug resistance. So, this R factor has been causing the multi drug resistance uh, factor in them, thereby causing health associated infection. In spite of administering any drug, these different microorganisms have been developing R factor in causing infection. Then we have Pseudomonas aeruginosa, Pseudomonas species, and other Pseudomonas species that have been important hospital pathogens. They have intrinsic resistance to some antibiotics and have the ability to survive even multiple in disinfection solution. So these Pseudomonas species have been so much resistance, have developed so much resistance to these antibiotics that they can even survive in disinfectant solutions also. Then we have tetanus spores, which survive in the dust and sometimes contaminate the items in the hospital. So, hospital tetanus is usually due to faulty sterilization techniques or other lapses in asepsis. So, if the sterilization technique is not properly adapted in the hospital, it might lead to hospital tetanus infection. The tetanus spore might spread into the patient. Then we have HIV, hepatitis B, and C viruses, which are transmitted by contaminated blood and blood products. So it is very much important for screening of the blood donors in order to reduce the risk of HIV transmission to a patient who is a non-HIV. So HIV detection is very much important, and HBV, HCV are also being detected before the blood is being accepted into the blood banks. However, HIV escapes detection during the window period. So sometimes it might be a misfortune that HIV might not be detected properly and the screening tests are not being done properly. And that time the HIV might be transmitted to non-HIV patients. So it is very much important to look into the proper screening test. Viral diarrhea, chickenpox are also a few infections that are being observed in patients. Then we have cytomegalovirus, influenza, herpes virus, enterovirus, arenavirus. So these are the different viruses that might cause hospital infection. Then we have Candida albicans, Aspergillus mucor, Entamoeba histolytica. Few bacterias and protists are being given here. Pneumocystis carinii, Toxoplasma gondii are some of the other microbes which can cause hospital infection. So that completes the microorganism part. In the next video, we will see the modes of transmission and the rest of the part in this chapter. Thank you. I hope you like the video. Please do like, share, and subscribe to the channel.